Y-shaped occlusal pattern is seen in option A, maxillary first premolar, option B, maxillary second premolar, option C, mandibular first premolar, option D, mandibular second premolar. Answer is option D, mandibular second premolar. The mandibular second premolar tooth assumes two common forms. The first form, which probably occurs most often, is the three-cusp type, which which appears more angular from the occlusal aspect. The second form is the two-cusp type, which appears more rounded from the occlusal aspect. The square type has three cusps that are distinct. The buccal cusp is the largest, the mesiolingual cusp is next, and the distolingual cusp is the smallest. Each cusp has well-formed triangular ridges separated by deep developmental grooves. These grooves converge in a central pit and form a Y shape on the occlusal surface. This reference from the Wheeler's Dental Anatomy, Physiology and Occlusion, 9th edition, page number 169. Question number 82. The sharpest and longest cusp of primary mandibular first molar is option A, mesiolingual, option B, distolingual, option B, distobuccal, option C, distolingual, option D, mesiolingual. The answer is option A, mesiolingual, which is the mesiolingual cusp is long and sharp at the tip, more so than any of the other cusps. The sharp and prominent mesiolingual cusp, almost centered lingually but in line with the mesial root, is an outstanding characteristic found occlusally on the primary first mandibular molar. Reference from the Wheeler's Dental Anatomy, Physiology and Occlusion, 9th edition, page number 63. Question number 83. During class 1 cavity preparation in deciduous first molar, which pulp horn is most prone to exposure? Option A, mesolingual, option B, distolingual, option B, distobuccal, option C, distolingual, option D, mesiobuccal. The answer is mesiobuccal. The reference is from Wheeler's Dental Anatomy, Physiology and Occlusion, 9th edition, page number 49. In this figure you can see the comparison of maxillary, primary and permanent second molars. Linguobuccal cross section, that is buccolingual cross section. In figure A showing the enamel cap, the A indicates the enamel cap of primary molars is thinner and has a more consistent depth, and B indicates a comparatively greater thickness of dentin. is over the pulpal wall at the occlusal fossa of primary molars and the C indicates the pulpal horns are higher in primary molars, especially the mesial horns. The pulpal horns are higher in primary molars, especially the mesial horns, and the pulp chambers are proportionately larger. And D indicates the cervical ridges are more. The cervical ridges are more pronounced, especially on the buccal aspect of the first primary molars. And D and E indicates the enamel rods at the cervix slope occlusally instead of gingivally as in the permanent permanent teeth. And F indicates the primary molars have a markedly constricted neck compared with the permanent molars. And you can see in the E the roots, and you can see in the G the roots of primary teeth are larger and more slender in comparison with crown size than those of the permanent teeth. And in H you can see the roots of the primary molars flare out near the cervical near the cervix than do those of the permanent teeth. And H indicates the roots of primary molars flare out near the cervix than do those of the permanent teeth. This flaring out is due to the accommodation of the tooth bud of permanent teeth or successor teeth. Question number 84. The largest cusp in permanent mandibular first molar is option A mesiolingual, option B distobuccal, option C distolingual, option D mesiobuccal. The answer is option D, that is mesiobuccal. The mesiobuccal cusp is usually the widest mesiodistally of the three cusps. This cusp has some curvature but is relatively flat. The distobuccal cusp is almost as wide with a cusp ridge of somewhat greater curvature. The two buccal cusps make up the major portion of the buccal surface of the crown. The two lingual cusps are pointed and the cusp ridges are high enough to hide the buccal two buccal cusps from view. The mesiolingual cusp is the widest mesiodistally, with its cusp tip somewhat higher than the distolingual cusp. The distolingual cusp is almost as wide mesiodistally as the mesiolingual cusp. A reference from Wheeler's Dental Anatomy, Physiology and Occlusion, 9th edition, page number 190 to 194. Question number 85. Which of the following is the least calcified structure? Option A acellular cementum, option B cellular cementum, option C cementoid, option D all are equal. Answer is option C, that is cementoid. The uncalcified matrix is called cementoid. Under normal conditions, growth of cementum is a rhythmic process, and as a new layer of cementoid is formed, the old one calcifies. A thin layer of cementoid can usually be observed on the cemental surface. This cementoid tissue is limen- this cementoid tissue is lined by cementoblasts. The reference from Orban's Oral Histology and Embryology, 14th edition, page number 119 and 120. Question number 86. Least calcified cementum is option A cellular cementum, option B acellular cementum, option C cementoid, option D dentin. The answer is cellular cementum, that is option A. The mineralization of cementum matrix may be controlled by hydroxyapatite crystals in adjacent dentin. The mineralization of cementum may be controlled by hydroxyapatite crystals in adjacent dentin. Periodontal ligament fibroblasts rich in alkaline phosphatase and non-collagenous proteins in the matrix like BSP, that is bone shallow protein. Mineralization is very slow and occurs in a linear fashion. Hence, there is no cementoid seen on the surface of acellular cementum. Hence, there is no cementoid seen on the surface of acellular cementum. Mineralization of the deeper layers of pre-cementum of cellular cementum occurs in the linear manner, but overall this type of cementum is less mineralized than acellular cementum. The reference is from Orban's Oral Histology and Embryology, 13th edition, page number 118. Question number 87. Dentin islands are frequently found in the root canals of which of the following permanent teeth? Dentin islands is seen in the where? In the root canals. Option A maxillary, lateral incisor and mandibular canine. Option B maxillary, second premolar and mandibular first molar. Option C maxillary, second premolar and mandibular canine. Option D maxillary first molar and mandibular second premolar. The answer is option B, that is maxillary second premolar and mandibular first molar. Dentin islands are frequently found in the root canals of permanent teeth permanent teeth, that is maxillary second premolar and mandibular first molar. Question number 88. A primitive basic tooth form having a single conical crown and a single root is known as option A thecodont, option B haplodont, option C acrodont, option D heterodont. The answer is option B haplodont. The haplodont class is represented schematically by the simplest form of tooth, that is the single cone. This type of dentition usually includes many teeth in both jaws and is seen where jaw movements are limited to simple open and close, that is hinge movements. Close means hinge movements. No occlusion of the teeth occurs in this class since the teeth are used mainly for prehension or combat. Their main function is the procurement of food. The reference for this answer is from Wheeler's Dental Anatomy, Physiology, and Occlusion, page 9th edition, page number 69. Question number 89. The chamfer finish line is used in option A, lingual surface of metal ceramic crown, option B, facial surface of metal ceramic crown, option C, facial surface of porcelain jacket crown, option D, lingual surface of porcelain jacket crown. The answer is option A, that is lingual surface of metal ceramic crown. You use the chamfer finish line. Chamfer finish line. That's finish line. Chamfer finish line. This finish line possesses a curved slope from the axial wall till the margin. It can be produced using a torpedo diamond point. The same diamond point, when used to reduce more tooth structure, will form a deep chamfer finish line. The same diamond point, when used to reduce more tooth structure, if you reduce more tooth structure, it will becomes a deep chamfer finish line. It is the finish line of choice for cast metal restorations and lingual margins of metal ceramic restorations. Reference from Textbook of Prosthodontics, Nalaswamy, page number 572. Question number 90. A prosthetic appliance to cover the palatal defect in patients with cleft palate is option A, artificial velum, option B, obturator, option C, removable prosthetic appliance, option D, none of the above. The answer is option B, obturator. Obturator is a process used to close a congenital or acquired tissue opening primarily of the hard palate and or contiguous alveolar structures. Prosthetic restoration of defect often includes use of a surgical obturator, interim obturator, and definitive obturator. G. Question number 91. Following is the first sign that appears in shock. Option A, hypotension. Option B, tachycardia. Option C, hypertension. Option D, syncope. The answer is option B, tachycardia. Reference from Davidson's Principles and Practice of Medicine, 22nd edition, page number 181. Clinical features of shock. Low flow shock, for example, hypovolemia. Cardiogenic shock. It includes rapid, shallow respiration, cold, clammy skin, tachycardia, that is greater than 100 beats per 100. Heart rate is greater than 100 beats per minute, and hypotension, that is say systolic BP less than 100 mm of Hg, and drowsiness, confusion, irritability usually occurs late. Oliguria, multi-organ failure, vasodilated shock, for example, sepsis, anaphylaxis. It includes rapid, shallow respiration very early, warm peripheries, tachycardia greater than 100 beats per minute, hypotension, systolic BP less than 100 mm of Hg, and disproportionately low diastolic BP. In early stages, there will be drowsiness, confusion, irritability can occur early. There is oliguria and multi-organ failure. Peripheries may be cool in sepsis with hypovolemia or if myocardial depression is present. Question number 92. True about endemic typhus. Option A. Man is the only reservoir of infection. Option B. Flea is a vector of the disease. Option C. A rash is developing into an eschar is characteristic feature. Option D. Culture is the diagnostic modality. The answer is option B. Flea is a vector of the disease. Flea borni or endemic typhus caused by R. typhi is endemic worldwide. Humans are infected when the feces or contents of a crushed flea which has fed on an infected rat are inoculated or introduced into the skin. The incubation period is 8 to 14 days. The symptoms resemble those of a mild lousy-borne typhus. The rash appears on the 4th to 6th day. In its early stages, it disappears on pressure but soon becomes petechial with subcutaneous matting. The rash may be scanty and transient. Diagnosis is made on clinical grounds and response to treatment and may be confirmed by antibody detection or PCR in specialized laboratories. Reference from Davidson's Principles and Practice of Medicine, 22nd edition, page number 351.